Hello, I'm Dr. John Abebe, the Medical Director of Jojo Abebe Fertility Center and the lead tutor at the Jojo Fertility Academy. You are welcome to the Basic Fertility Training Program for doctors, and you're welcome to the Module 4 of this program. We're looking at the etiology and treatment of infertility. Under this module, we're looking at 6 different units. We look at male infertility, the female infertility, combined and unexplained infertility, assisted reproductive technologies, fertility preservation, and lastly, we'll look at surgical interventions in fertility care. Under the male infertility, we'll look at common causes of male infertility, such as varicocele, spermia, oligospermia, erectile dysfunction, and ejaculatory disorders. We'll also take a look at diagnostic approaches and the treatment options, such as surgical correction, hormonal therapy, and then assisted reproductive technologies. Under the female infertility, we'll look again at common causes, such as polycystic ovarian disease syndrome, endometriosis, tubal factors, infertility, uterine anomalies, and diminished ovarian reserve, to mention but a few. And then we'll take a look also at diagnostic approaches and treatment options that are available, such as ovulation induction, surgical interventions, and assisted reproductive technologies. Now, under the combined and unexplained infertility, we'll be looking at the approaches to management and treatment, and the role of lifestyle modifications and supportive therapies. And then under the assisted reproductive technologies, we'll take a look at one, in vitro fertilization, the protocols, the indications, and the success rates. Intracelluloplasmic sperm injection, ICSI, we'll look at indications and techniques. Intrauterine insemination, we'll look at indications and protocols. Pre-implantation genetic testing, we'll look at techniques and applications. And then under cryopreservation, we'll look at the egg, sperm, and embryo freezing techniques and indications. Then under fertility preservation, we're looking at options for patients undergoing gonadotrophic treatments, e.g. cancer patients. We'll look at the techniques for oocyte preservation, sperm banking, and ovarian tissue freezing. We'll look at the indications, the procedures, and the ethical considerations for fertility preservation. And then under the surgical interventions in fertility care, which is the last unit, we'll take a look at laparoscopic and hysteroscopic procedures for endometriosis, fibroids, and tubal blockages. Also look at microsurgical techniques for male infertility, such as varicocelectomy, vasectomy reversal. All right. What are the learning objectives of this module? This module focuses on understanding the common causes of male and female infertility, diagnostic approaches, and the various treatment options available. It also covers the use of assisted reproductive technologies, ART, and fertility preservation strategies, along with surgical interventions in fertility care. This module is essential for professionals involved in diagnosing and managing infertility. And it is hoped that by the time you've gone through this module, the following learning objectives would have been realized. One, under male infertility, have an understanding of common causes of male infertility, diagnostic approaches, and treatment options. Two, under female infertility, to learn the causes of female infertility and the diagnostic and treatment options available. And three, under combined and unexplained infertility, to explore the management strategies, including the role of lifestyle modification and supportive therapies. And then four, under assisted reproductive technologies, to learn about IVF, ICSI, IUI, PGT, and cryopreservation techniques. And then under fertility preservation, to understand the techniques for preserving fertility in patients undergoing gonadotrophic treatments and the ethical considerations involved. And lastly, under surgical interventions, to gain knowledge about surgical procedures for endometriosis, fibroids, tuber blockage, and male infertility. Okay, so I wish you a great time going through this model 4, and I do hope that you would gain a lot of knowledge and achieve the set learning objectives. So do have a nice time and see you in model 5.